So today's video is about solving the MCQs related specifically with the first substage topics of the lower limb. And the first substage topics of the lower limb usually include bones such as femur and hip bone, anterior compartment of thigh, its muscles, their origin, insertion, nerve supply, and action, and first of all, skin and fascia, cutaneous innervation of the skin. Medial compartment of the thigh also include the muscles, nerves, and vessels, either present or supplying these compartments of the thigh. So let's see an MCQ related with the skin of the thigh. The stem of the question reads, skin anterior to greater trochanter is supplied by. Now, for all the students out there who shall be taking their first professional exam part 1, inshallah ta'ala, with the University of Health Sciences, they must remember one thing about the university and the MCQs that the university gives. There is a rule set by university. It never gives anything in the paper outside of their recommended textbooks. So remember, another rule of the university is they always try to be dodgy in the sense that they do not even leave the diagrams or flow charts or tables besides the text present in the textbooks. And they give any question from any flow chart, from any diagram that is present within the anatomy textbooks. This rule is true for the gross anatomy, histology, embryology, and general anatomy, as well as neuroanatomy. So, आपने कहने का मतलब ये है कि आपने किताब का कोना कोना छान मारना है, और अगर आपने यूनिवर्सिटी के एग्जाम में पास होना है और ना सिर्फ पास होना है बल्कि अबव एवरेज स्कोर करना है, तो बेहतर है कि आप अपनी रिकमेंडेड टेक्स्ट बुक का एक कोना भी आपने नहीं छोड़ना. So, this is why I have chosen this MCQ to prove the point. Skin anterior to greater trochanter is supplied by genitofemoral nerve, lateral cutaneous branch of subcostal nerve, lateral cutaneous nerve of the thigh, obturator nerve, femoral nerve. Now, skin anterior to greater trochanter is supplied by. What hint can you pick up from the stem? You are supposed to pick up the true answer. Since no such words are mentioned in the question as incorrect, least likely, unlikely, and also not, N-O-T, not. So, skin anterior to greater trochanter is supplied by. You have to choose the true option, correct option. Also pay specific attention to the hint given to you in the stem of the question. आमतौर पे जो यूनिवर्सिटी के क्वेश्चंस होते हैं, MCQs खास तौर पे, उनके अंदर कोई ना कोई आपको ऐसा हिंट जरूर दिया हुआ होता है. इसलिए my advice to the students, especially to the medical students who shall be appearing in the exams in their final exams with the University of Health Sciences, always give 30 seconds to read the stem of the question. Because I know time limited hota hai, you have 45 questions in your professional exam, तो 45 ही minutes आपको मिलते हैं. And usually जो UHS के invigilators होते हैं, they are pretty much strict about the time limits provided by the university for specific part of the paper. So 45 questions in MCQs, so 45 minutes मिलेंगे. So how are you going to manage 1 minute for one MCQ? Always make a habit. Read the stem of the question. Do not get anxious or nervous. Stay relaxed, because in 70 to 80% of the times, an average student even knows the answer of an MCQ. And also, about 50% of the paper is made by keeping in mind the average students who can easily attempt the paper MCQ. So 50% of the MCQ portion is made easy. Skin anterior to greater trochanterus. Now, yes, this question is related with the cutaneous innervation of the thigh, but not the complete thigh or not the complete lower limb. This question is asking you for a specific part over the specific landmark or near the specific landmark. So the specific part asked is skin and location is anterior to greater trochanter. So which of these options is the correct option? Look in this diagram on the right side. Lateral cutaneous branch of the subcostal nerve, 12th thoracic nerve here. This small uppermost and lateralmost side of the thigh is supplying to the skin over the greater trochanter of the femur. So the correct option is lateral cutaneous branch of the subcostal nerve. Next question is related with the facial lata. Facial lata, the question reads, facial lata does not. Now, you have to pick up the incorrect option or false option. How are you going to crack down this MCQ? General scheme to get the right answer for an MCQ is always adapt the exclusion policy. Whatever is asked in the question, for suppose this one does not. So you have to pick up the incorrect or false option. So start by excluding the right options, right? Let's see. Option A, meet Scarpa's fascia at the inguinal ligament. Facial lata does not meet Scarpa's fascia at the inguinal ligament. Again, read very carefully the stem of the question as well as the options and try to correlate the two. Second option is continuous with the iliotibial tract. That's right. So it's a true option. Is continuous with the deep fascia of the calf posteriorly. Yes, again, it's a correct option. Splits to enclose the tensor fascial lati and gluteus maximus muscle. That's very true. Both of these muscles, they get inserted into the fascia lata. Or we can put it in this way. Fascia lata splits to enclose these two muscles. So which option is left? Option A, meet Scarpa's fascia at the inguinal ligament. Does it meet the Scarpa's fascia at the inguinal ligament? No, it does not. It does not meet the Scarpa's fascia at the inguinal ligament. It actually meets it under the inguinal ligament, one finger breadth under the inguinal ligament. Next question is related with the muscles. So psoas major. Now you can see the only words provided in the questions are the name of the muscle. So such questions are called blind-ended questions. They give you an open question and you have to pick up the right option. Usually you have to pick up the right option. So read the options very carefully and pick up the right option, which is closely related with the psoas major muscle. So let's see the option 1. A, femoral artery lies on it, inserts into the greater trochanter. Its only action is to flex hip, supplied by anterior division of the femoral nerve. Now, again, apply the exclusion policy or strategy. Which of these options are false? inserts into greater trochanter? No, it does not. It gets inserted into the lesser trochanter. Its only action is to flex hip. No, it not only acts at the thigh to flex it at the hip joint, but it also helps to flex the trunk over the hip joint. Then again, supplied by the anterior division of the femoral nerve. No, femoral nerve does not supply psoas major. Actually, it receives direct innervation from the lumbar plexus. So, which of these options is left? Femoral artery lies on it. Yes, that's true. This is a true fact related with the psoas major muscle. In this diagram, you can see here we have iliopsoas coming down to get inserted over the lesser trochanter of the femur. So psoas major along with the iliacus muscle. Iliacus is located laterally and psoas major is located medially. And this muscle is basically providing a base or posterior wall over which the femoral artery lies posteriorly. Again, you need to keep one thing in mind, that University of Health Sciences is actually fond of giving MCQs by by literally giving lines of the KLM or Snell or whatever their recommended textbook is. So in order to crack the MCQs, you have to make a strategy. Always keep in mind that whatever topic you are finished for one day or in a day, suppose, let's see, we have studied femoral triangle. Give yourself time to go through the reading of femoral triangle from your textbooks. Secondly, recall whatever you have read about the particular topic in your own mind, or if you are in the habit of writing down in the notebooks, write down your recall memory regarding that particular topic. And after that, solve at least 4 to 5 MCQs at the end of the topic. 3 to 4 or 4 to 5 MCQs related with that topic. MCQs are actually the quick revision of any topic, and this strategy is especially successful in remembering anatomy and revising anatomy. So let's see an MCQ related with the femoral triangle. Floor of the femoral triangle excludes. Now look again, read the stem of the question very carefully. इसमें उन्होंने दोबारा आपको एक एक्सक्लूड करवाया है, मतलब ये आपको एक फॉल्स ऑप्शन ढूंढनी है, एक लीस्ट लाइकली ट्रू ऑप्शन ढूंढनी है, या अनलाइकली ऑप्शन ढूंढनी है. ठीक हो गया. सो फ्लोर ऑफ द फेमोरल ट्रायंगल एक्सक्लूड्स स्पॉन्टेनियस. अब यहाँ पे आपने व्हाट स्ट्रेटजी यू आर गोइंग टू अप्लाई. You will apply the strategy of excluding the right options or right or true facts related with the floor of the femoral triangle. So pectineus, iliacus, psoas major. All of these muscles more or less form or come into the floor of the femoral triangle except psoas minor. Now most of you will confuse that how come pectineus and why not psoas minor, because psoas minor is actually accompanying psoas major. For that, look in the diagram. This is why University of Health Sciences MCQs are tough, because most of the students, they ignore looking at the diagrams given in their recommended textbooks, because University is in the habit of giving MCQ or SCQ, picking up any fact or structure from the diagrams or the flow sheets or the charts or tables given in the recommended textbooks. So you cannot actually escape any corner of your recommended textbook when you are appearing with the University of Health Sciences. So it would be to cope with vast subject of anatomy, the best strategy to adapt during your academic session is to actually read a topic, revise the topic in your mind or write it down with the help of your recall memory, and then at the end, always attempt 4 to 5 MCQs related with that topic. Revision and repetition is the key to memorize, and as well as visual memory. These are some of the few keys to be successful and to pass your anatomy exams with above average marks. So look in this diagram. Psoas minor is actually accompanying psoas major, but look at their distal attachment. It has ended just above the or over the superior ramus of the pubis. It is not extending down like psoas major is. This is why it is not coming into the floor of the femoral triangle. It has attached proximal to the floor of the femoral triangle. So ये जो मसल है ये पूरा थ्रू आउट श्वास मेजर की तरह नीचे तक नहीं आया. इट इज नॉट एज लॉन्ग एज श्वास मेजर. ये ऊपर ही अटैच हो गया है और नीचे फेमरल ट्रायंगल के लेवल पे ये पहुंचा ही नहीं है. तो इस वजह से ये श्वास माइनर जो है इट इज एक्सक्लूडेड फ्रॉम द फ्लोर ऑफ द femoral triangle. Now let's see a question related with the adductor canal. Which of the following is incorrect regarding the adductor canal? Now you must remember that university is not actually in the habit of giving such questions as incorrect or not. They either use terms as most likely or least likely to replace incorrect and incorrect words in the stem of the question, or when they are asking about a false fact related with that particular structure. So always keep in mind the alternative terms that are used to describe or ask the same thing. Most of the students, they do not follow these alternative terms. They do not keep those alternative terms in their minds. This is why they often confuse and ultimately attempt the question wrongly. So which of the following is incorrect regarding the adductor canal? University may also put it this question as which of the following is most likely or least likely? In this case, least likely associated with the adductor canal. So let's see which incorrect option or false option they have provided regarding the adductor canal. Sartorius lies on the facial roof. That's a true fact. In the distal part of the canal, femoral vein is posterolateral to the artery. If you remember the course of the femoral vein and artery in the adductor canal, you will come to know that femoral vein actually at first lies posterior to the artery within the adductor canal. Then as it further ascends into the adductor canal and finally reaches the apex of the femoral triangle, it comes to lie on the medial side. So in adductor canal, it either lies posterior or posteromedial to the artery. In adductor canal, the artery lies between saphenous nerve and femoral vein. That's true. Subsartorial plexus supplies overlying fascia lata and an area of the skin above the medial side of the knee. That's actually true. The adductors in the floor of the canal are the adductor longus above and adductor magnus below. That's again true. So the only false option left is option B. In the distal part of the canal, the femoral vein is posterolateral to the artery. No, it's not. It's actually either posterior or posteromedial. So you have to again apply the exclusion strategy. Exclude, if you are asked the incorrect option, exclude the right options. And if you are asked a true option, exclude the false options. So the answer is B. In the distal part of the canal, the femoral vein is posterolateral to the artery. In this diagram, you can see this is a transverse section cut at the middle of the thigh. And here, this black circle is enclosing the location of the adductor canal with its contents shown in it. And you can see that artery and nerve and vein is actually shown to be medially located. But if you look at the anterior side or anterior view of the adductor canal, you will see that it first lies posterior, then comes posteromedial, and finally, as it further ascends to enter the apex of the femoral triangle, it becomes medial. I hope this video was of any help.